All right. Good afternoon, everybody. Thank you for joining. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Pleased to be joined today by the CEO of Chicago Public Schools, Pedro Martinez, as well as Dr. Alexandra Sontag, a nurse practitioner with Chicago Public Schools, and Dr. Geraldine Luna, Medical Director at Chicago Department of Public Health. We'll be providing a COVID update with a particular focus on pediatric vaccine planning, and then I'll hand it to Mr. Martinez for the details of CPS and its vaccine planning. So we're really excited to talk about this. I just want to start from the very beginning by saying today is the day that the advisory committee to the FDA is evaluating pediatric vaccines for 5 to 11-year-olds. They are not authorized at this point. The FDA needs to complete its review and recommendations, and then the CDC needs to complete and review its recommendations. But if everything moves as expected, we may have vaccines for children 5 to 11 possibly as soon as next week, and we have been planning for months around this, and I'm really excited to share the details with you. So first of all, overall, Chicago, our travel advisory, we continue to see improvement across the U.S. with the Delta variant. As of today, Georgia, Louisiana, Maryland, and Mississippi are all being removed from the travel advisory. As a reminder, the states in yellow are where we are seeing fewer than 15 cases per 100,000 per day. For the states in orange, people who are unvaccinated still should avoid travel if possible. If you do travel, you should be testing before and after and quarantining upon return. I will note we don't report a travel advisory for the state of Illinois, but Illinois would also be off our own travel advisory, really the only state in the Midwest at this point that is at that level. Where we look generally, nationally, 24 cases per 100,000 per day is the national average right now. That's half of what we were seeing just a few months ago. Chicago, we're less than half of that, 10 cases per 100,000 per day. Pleased with that. Hospitalizations, nationally, the average is 18 COVID patients per 100,000 people getting hospitalized each day. Here in Chicago, we're also about half that at 10 per 100,000. So continuing to see progress. Everything that we are detecting here in Chicago, across Illinois, and across the United States continues to be the Delta variant, 99.9%. That is good news. Although the Delta variant is more contagious, and it's part of what has led to this surge, it means that we have not seen new variants emerging that can outcompete or be a better fit than the Delta variant. So if we can maintain Delta variant while we get people vaccinated, that's a really good sign for us being able to move past COVID. We continue to monitor this week after week after week in Chicago. We will, of course, share with you if and when new variants of concern arise. Here in Chicago, looking at our matrix, we're currently averaging 285 cases per day across the city of Chicago with good testing. With that testing, we're at a 1.6% positivity. I'll just remind you that when we get under 200 cases per day, per CDC, we would move out of that substantial transmission category. That would be the setting in which we would be potentially removing the indoor mask requirement, just like we've done all along here. So we're not there yet, but we're making good progress. We continue to have good capacity in both the ICU and the non-ICU. We currently have 161 patients not in the ICU, hospitalized with COVID across Chicago, and 59 in the ICU. This is just what our graphs are looking like. You can see with this 285 cases per day, continuing to see a nice slow decline there. Our test positivity, also a good decline. You can see the Delta variant surge was actually smaller than our Alpha variant surge here, and that is because of good vaccination rates. I also want to highlight that we are seeing a lot more testing in children. This is specifically because school, not just CPS, but all schools are back. And so we have actually seen a quadrupling of testing among Chicagoans 0 to 17 since the date of CPS's reopening. On this graph here, that dark blue always represents 0 to 17-year-olds. And children aged 0 to 17 are now making up about 1 in 5, 20% of the CPS, of the tests that were performed performed during the Delta wave, and more than a quarter, 27% of the tests being done across the city since CPS reopened. That is much more than twice the rate at which kids were getting tested earlier. So earlier on, only 11% of our total tests were in children, and only 7% during last winter's surge were in children. So doing a lot more testing among young children. Despite that, we have not seen an increase in cases among children, which is very, very good news. Continues to speak to the safety of our schools. And that's true for CPS, that's true for schools across this city. So despite that increased testing, again, the dark blue here represents 0 to 17-year-olds. And you can see since August, we've been seeing some decline there. We are seeing children represent a larger proportion of cases during the Delta surge. About 1 in 5 cases in Chicago are in children right now compared to prior surges. And that's just because more adults have been vaccinated. So one of the reasons we're really excited about the potential for younger children to be vaccinated is they too will have the opportunity for protection. We continue to track every week our rates of COVID cases among unvaccinated versus fully vaccinated Chicagoans. Still, your biggest risk for being diagnosed with COVID is not having gotten those first doses of vaccine. Even if we limit it just to the Delta surge, just in Chicago, unvaccinated Chicagoans more than twice as likely as vaccinated Chicagoans to have been diagnosed with COVID. We also did some analysis of that same time period, looking at the children who have been eligible already, our 12 to 14 and our 15 to 17-year-olds. So right here in Chicago, just during the Delta surge, if we look at 15 to 17-year-olds, 7 times more likely to have been diagnosed with COVID if they were unvaccinated versus fully vaccinated. And if we look at 12 to 14-year-olds in Chicago, more than 10 times as likely to have been diagnosed with COVID if they're unvaccinated versus fully vaccinated. These vaccines are safe and they are effective. That includes in children. And I really want to encourage you, if you've not had a chance yet to get your older child vaccinated, now is a great opportunity. And as we're talking about the potential for younger children, we really want to make sure that children of all ages are having that opportunity for vaccination. Similarly, our hospitalization rates remain much higher among unvaccinated versus fully vaccinated Chicagoans. The risk is more than 5 times just during the Delta surge here in Chicago of being hospitalized for people who are unvaccinated. We've not had children, hospitalized during this surge. Any breakthrough infections, I should say, in children during this surge. And similarly, deaths remain much higher again among unvaccinated versus fully vaccinated Chicagoans. Unvaccinated Chicagoans more than 8 times as likely to die just during the Delta surge in the last couple of months, just here in Chicago, than Chicagoans who are unvaccinated. So, I want to just give an update on deaths. I continue to see on social media misinformation being spread that there are a lot of people dying from COVID vaccines. It is just not true. As of October 21, at least 6,043 Chicago residents have died as a direct result of COVID-19 infection. 5,967 of those deaths, 99% of them, were in people who were not fully vaccinated against COVID, obviously most of them before a vaccine was available. In contrast, 0 Chicago residents have died as a direct result of receiving the COVID-19 vaccine. We've talked to the medical examiner about this. We've looked at this as CDPH. I can't emphasize enough the difference between these numbers. I also want to emphasize that breakthrough cases remain rare in Chicago. Still, more than 99% of fully vaccinated Chicagoans have not tested positive for COVID, although that happens more often in people who are over 65 or with underlying conditions, which is why we're recommending boosters. More than 99.9% of fully vaccinated Chicagoans have not been hospitalized for COVID-19, and more than 99.99% of vaccinated Chicagoans have not died due to COVID-19. These vaccines continue to protect really well, and it's essential that people take the opportunity to get vaccinated as the weather is cooling off and we're moving more inside. Quick update on Protect Chicago 77. Citywide, 74.7% now. Nearly 3 of 4 eligible Chicago residents over the age of 12 have gotten at least a first dose. I want to give a shout out to Logan Square as the neighborhood that hit 77% this week. On this map here, you see the darkest blue are the community areas that have hit that 77%. We're making progress across the city. Our best progress this week was in East Garfield Park in terms of the biggest increase week over week. And you can see in the darkest blue here, it's really the areas with the most need for catching up that are catching up. And thanks to everybody working in those communities and making those decisions to get vaccinated now. I also want to highlight that we need people to get fully vaccinated. So as a reminder, you are considered to have completed a COVID-19 vaccine series if you've had 2 doses of Pfizer or 2 doses of Moderna or 1 dose of J&J. That remains true for all requirements, all public health purposes. You are not required to get a booster, although it is certainly recommended, especially for people over 65 or anybody who got the Johnson & Johnson. But you can see citywide, we're at about 68.8% of eligible Chicagoans have gotten a complete vaccine series. So if you only got 1 dose of the Moderna or the Pfizer, not too late. Please get your second now. I also want to give congrats to 4 more community areas that reached that 80% mark for first dose coverage: Beverly, Edison Park, Hyde Park, and West Ridge. So pleased to see all over the city good improvement. All right. We were getting a lot of questions about what kind of vaccines had Chicagoans received. And so I'm sharing here with you the breakdown that where we look in yellow here at Chicagoans over 65, approximately 56% had gotten Pfizer as their original vaccine, 40% had gotten Moderna, and just 4% had gotten J&J. And you can see through 18 to 64-year-olds, similar, although a little bit higher for Pfizer and J&J and a little lower for Moderna. So We've been sharing about boosters, and I devoted my whole Facebook this morning to boosters. So if people have questions, we'll take them. But the short version is that anybody who got a 1-dose Johnson & Johnson vaccine over the age of 18 should get a booster 2 months later. And anyone who got Moderna or Pfizer, if you're over 65 or you're over 18 with an underlying condition or you're working in a high-risk setting, you should also get a booster. We estimate that already there are more than 207,000 seniors eligible for a booster. 80% of Chicago seniors are already eligible for a booster. So if you know somebody over 65, chances are good they're already eligible, and we'd love them to get those boosters now. We have also made boosters available through our at-home as of this week. Oops, and there is the at-home. As a reminder, 312-746-4835. We continue to have Pfizer or Johnson & Johnson available to anybody over the age of 12. We do continue to offer the vaccine incentives, the $100 gift cards as part of this program, but you cannot get an incentive for a booster. Let's talk about kids. Is the Pfizer vaccine that is being evaluated for younger children the exact same vaccine that teenagers and adults received? Yes, it has the exact same ingredients. Yes, it is the exact same time frame. Children will need 2 doses 3 weeks apart. And yes, they do need to get both for that protection. But it is only going to be 1/3 the dose. So this is because younger children have a smaller body mass, and in the studies, they had the same level of antibodies and protection, but the lower dose makes it less likely that the 5 to 11-year-olds will have side effects. It also means there are smaller needles that are being distributed specifically for pediatric providers, and then this smaller dose means that there is specific distribution of child vaccine vials. So we won't have people pulling adult and children doses out of the same vial. There is a separate process for child vaccines. Are there any other ways that the proposed child vaccine process will be different? Just like adults, the vaccine will remain free. No insurance, no identification, no doctor's order required. Just like adults, we expect COVID vaccine will be able to be given at the same time as other vaccines, including flu or other childhood vaccines. I got my flu vaccine and my COVID booster on the same day about a week ago. We do expect much more availability than we had early on for adults. Please make an appointment where possible. It just helps us plan, but in many cases, we will be able to accept walk-ins, and you can follow vaccines.gov if you want to see ongoing availability. In the first few weeks, CDPH is really focusing on some of our larger sites for pediatric vaccination. We will make at-home appointments available a little bit later, mid-November. But in the meantime, if you are calling to make an at-home appointment, if there's a family member who has not yet gotten their first or second doses, we will vaccinate a 5 to 11-year-old in that same visit. This is not going to be the Hunger Games. We estimate that there are 210,448 children living in Chicago between the ages of 5 and 11. I would like to reassure you that nearly 100,000 pediatric doses are tentatively scheduled to arrive in Chicago in the first week of pediatric vaccine alone. I would love to have half of the 5 to 11-year-olds get vaccinated in the first week. It's not going to happen, but I want to reassure you there will be vaccine available for your child. These 98,900 pediatric doses just for that first week, already we've planned for them to be distributed at more than 125 locations citywide. There's more than 17,000 that are going to pharmacies, Walgreens, CVS, Walmart, Costco, Mariano's, Jewel-Osco. Your child can be vaccinated at your pediatrician or your family doctor. We would love them to go to their regular provider. They can help them get caught up on other vaccines, answer questions. This should really be your first check. We've got more than 70 larger pediatric providers across Chicago that CDPH has already worked with and already scheduled to be able to each receive at least 300 pediatric doses tentatively that first week of November, assuming vaccine is authorized. As soon as the FDA gives the authorization, shipping will begin. No vaccine will go into arms until after the CDC gives the go-ahead. But our goal is to be ready, have a calm rollout. The number of pediatric providers is only going to grow. We've offered the opportunity for all Chicago pediatricians and doctors' offices to receive pediatric vaccines, and we'll have some smaller allotments available beginning likely the second week in November. All federally qualified health centers serving children have already placed orders over actually the first 10 weeks. There will be vaccine available. The best place to go is your pediatrician, and we will make available the lists of which pediatricians will have vaccine right from the beginning. On the pharmacies, all local Walgreens right away will be offering pediatric vaccines from the first week. And as I said, we expect many others here also are getting vaccine that very first week. And pharmacists are able to vaccinate children all the way down to the age of 3 in Illinois. And then finally, there are going to be a lot of pediatric-focused hospital and other community events. Just to give you a sense of the planning, nothing can go forward for sure until we know that a pediatric vaccine has been approved. But just to give you a sense, Comer Children's Hospital at the University of Chicago is tentatively planning its first pediatric COVID and flu vaccine clinics for both patients and non-patients the weekend of November 6 and 7. And you should be checking their website. There's be opportunities to make appointments. Lurie Children's Hospital is also tentatively planning its first pediatric vaccine clinic, maybe as soon as November 5th. There will be appointments Fridays, Saturdays, Sundays. Again, you're going to have to go on the schedule, but the point is we're ready to go all over this city as soon as vaccine does become available. St. Anthony's Hospital planning a large pediatric and adult COVID vaccine event, again, likely November 7, open to patients and non-patients. So check with your pediatrician, check with pediatric providers, and all of these pediatric providers are also working with schools. So Comer, for example, is doing multiple school-associated vaccine clinics with a lot of the charter schools. We know there are private schools that are doing a lot, and you're going to hear from CPS in a minute. And then finally, beginning mid-November, CDPH will also be standing up some larger weekend clinics specifically and other community-based events. So we'll be at city colleges to have large family-focused COVID clinics over 6 weekends. kids. We're going to start the weekend of November 13 and skipping the weekend of Thanksgiving. We plan to go really into January, over 6 weekends. We'll have Pfizer, Johnson & Johnson, first vaccines, boosters, whatever people are needing. And then, as I said, beginning likely November 15, we will begin having pediatric vaccine appointments, including through our at-home program. And so finally, your child can also be vaccinated at school. And with that, I am really excited to hand it over to CEO Martinez to give some more details about CPS's planning on this. We're ready and we're excited for whenever pediatric vaccines for 5 to 11-year-olds are authorized.
Thank you, Dr. Arwady. And I don't know about everybody, but for myself being a parent of an 11-year-old and a 7-year-old, having vaccines available as early as next week, it couldn't be better news. So let's start with some of the data points that we've always shared to give you an update. This is the number of cases reported per week. And you can see where we're at. This is as of the 17th. And you do see a small tick up on student cases that we started hitting close to 200 the week of the 17th. I can tell you right now that I just looked at the week for last week, because there's always a week lag. We're back down closer to about 160. So we're not seeing a big spike in cases, as we look at week to week. Very consistent with what Dr. Arwady is describing in the city. Staff cases could pretty much have been also very, very flat. So again, the message here, everybody, schools are safe. This is right now, this is actual cases. Remember, cases come from all sources, whether somebody finds out they're positive through a test independently outside of the school, through their doctor, or at the school. With that, now we are seeing now a steady decline of both staff and students being quarantined. For me, it's still too high. And so one of the things I'll talk about is just, again, what I see in November as we start having better strategies around how do we start reducing the number of children in quarantine. Again, all of it will be in consultation with Dr. Arwady, the Department of Health, as well as my health professional team. But right now, you can see we are seeing a decline. It did help that we reduced the quarantine period from 14 to 10 days, but I still feel right now we still need to be more strategic in how we start reducing quarantine, children being quarantined. I know we still get a lot of questions about COVID testing. As I shared with you, this is a process, and we are building capacity every single week. We hit over 21,000, almost 22,000 tests just last week. I can tell you right now, even as I look at capacity today was the first day, or yesterday was the first day we hit over 5,000 tests. So if you look at for the week, we are now at a capacity of almost 25,000 or more tests for the week. What I anticipate as we go into next week, that capacity will continue to grow, and by next week, we could be at a place where all of our children that have signed up, as well as our unvaccinated staff, would have access to testing. Now with that, I will tell you, we're going to 515 schools. Even though we have the capacity now for all 515 schools, we still will always have a few hiccups every once in a while. So I ask everyone, please let's be patient, because, and what we'll do is we'll deal with those tactical issues. So for example, we might have staff going to a school, and for some reason there's a mix-up on a schedule, or maybe something happened at that school where the vendor didn't have enough supplies, enough, et cetera. We're dealing with those issues, but from what I'm seeing, they're very isolated. We're not seeing it across many schools. Across, I would say, 98 to 99% of schools, we're not seeing challenges with testing, but that 1 and 2% is just something that we still have to continue to work towards. It's going to get easier as the capacity continues to build. And so as we get into November, what I see with our testing is that we will not only have the capacity for our children that have signed up, which right now is about 27,000, unvaccinated staff, but we will have excess capacity. And really some of the tactical questions we're starting to look at now is how do I get permission from our parents so that, for example, I am in Ms. Garcia's 5th grade class, we suspect there's a case, we suspect there might be children that are exposed. How can I mobilize and test that whole class so that we can, again, be more strategic on who we quarantine? Even looking at the CDC right now is looking at other strategies that some districts are already trying around testing before we quarantine children, so that's this test to stay. So again, those are the strategies that we're going to finally be in a place to look at in the month of November. But folks, it is, keep in mind, it wasn't that long ago, back in even just when I was starting, we were less than 5,000 tests per week, and we're now we're at the capacity of over 25,000. That has happened just in the last month. I'm very proud of the fact that over 89% of our staff are vaccinated. I will tell you, we also have a large number of staff that are on their first shot, going for their second shot. That's going to put us well over 90%, and that's not even counting all of our staff that have had medical or religious exemptions. So I'm very confident as we progress over the next month or two that we're going to get very close to 100%. So I don't see any issues there. I still worry about the fact that less than 50% of our 12-year-olds and up are vaccinated. And when you connect the data points that Dr. Arwady just shared, this is something we have to continue to talk about with our families. I do think there's an opportunity as we start rolling out 5 to 11-year-old vaccines, because for me, it's not just the 5 to 11-year-old, it's also the family. So if we can get unvaccinated adults as well as older children, it would be great to make it a family effort. And this is right now, you can see right now the total number of students that have been vaccinated. So let's talk now to the campaign. So first of all, again, we are blessed to have Dr. Arwady and the Department of Health, and they're going to be bold and laying out a strong campaign across the entire city. We have a role as well, because we know with our families, we need to make sure we can address families that frankly don't have the same level of access always to medical professionals, or for different reasons, because maybe somebody's working 2 jobs, they're working second shifts. It's just harder for them to get their children vaccinated. Oops, it's a little slow. Okay, here we go. So for us, we are looking at all components from, again, how we're going to work. So we have, the great news is we have actual school-based clinics where we have partnerships with medical providers, and so we're already planning with them about how they can help us in rolling out vaccines. We're going to do a big marketing and education campaign. So the great thing about us, we have the children. We have the children. Our principals can have meetings with parents. We can have conversations, but again, we want to be very intentional, because what families need is just good information, especially from medical experts. And like I said, having Dr. Arwady and her team is just an amazing asset for us to be able to share that information. And we're going to be very aggressive as we outreach to the community. Most of the communities that have low vaccination rates are in my district. And so I want to make sure that we have a strong plan. Oops. And so for us, when I share, one of the things we want to be very intentional in our district is we know that our families that are more affluent, they're going to have easier access, but many of our children, whether it's our immigrant children or children that are diverse learners, we have different areas that we just know, and we know even from current vaccines available for 12-year-olds and up, we're going to have to be aggressive how we create outreach to them. So with that, I'm going to bring Allie, one of our amazing leaders in our health professional team, to talk more about our plan around vaccines.
Thank you, CEO Martinez. So a couple things right now. What you're seeing is a map that's available on our cps.edu website, and it has a link to all of the vaccination sites located in CPS. Right now, this is 5 to 11. As vaccine expands, this is 12 and up. As vaccine expands to 5 to 11, we'll start folding in 5 to 11 into these vaccination sites. So on top of leveraging our private and community partners, we have 4 regional vaccination centers set up throughout the city of Chicago. And then we also are leveraging our school-based mobile events through a partnership with SIMPAR and on top of our school-based health centers. We're also leveraging consistently our external partners. So what we did is we looked at a list of all of the locations where our students got 12 and up got COVID vaccinations. And what we saw was there was a couple, large groups. So FEMA was a big one with the United Center, St. Anthony's Hospital, Esperanza, a lot of our federally qualified health center partners. A lot of those partners already have relationships with us as part of our school-based health centers. So we're going to leverage those relationships moving forward as vaccine expands to 5 to 11. Also thinking about our large health system partners, leveraging those relationships, thinking about how we relate to our Medicaid managed organizations, how do we connect our students not only with care for this, but care moving forward, thinking about that idea of a medical home. Also leveraging our existing community partners such as Access, Cook County, Heartland, and Erie, all of which participate in our school-based health centers and are great resources for our community at large. And then a little bit about marketing and education. We know the best thing that we can do around COVID vaccination is provide facts from about trusted medical information. And it's the idea of using trusted voices to carry this message. In our communities, our trusted voices are our parents, our students, and our teachers, our school nurses, our Medicaid designees. We have so many voices in our communities that our families already trust, and we need to provide them with the information to share with our families in a consistent way. We'll be leveraging first-person testimonials based on personal experiences of receiving the vaccine, why parents chose to vaccinate their child, why students were excited to get vaccinated, and then leveraging a variety of communication channels and methods, looking at paid media, social media events, news coverage, really maintaining a long-term campaign. We know that there's misinformation out there, and we want our families to have access to the highest quality information so that they can make good, healthy choices for themselves and their children.
So again, we're going to leverage we are partnering with multiple groups, but we're going to leverage every medium to do outreach to our families. And as Ali said, the great thing is that we already, for example, are starting to work on videos. In fact, there was a video we're going to show you today, a student video for 12 children that are actually at middle school and high school that we'll send to you. But we're already creating strategies of how do we encourage more of our families, more of our children to get vaccinated. Here's just some examples of some of our marketing campaign materials you can see in Spanish and English that we'll start distributing through our different channels. And again, the strength we have is we have our schools. The children are in person. We have access to meetings with parents. And so we're going to do our part to make sure that our families know that this information exists. Here's some other examples. I think this is the last one. Oops. Yep. So I will bring Dr. Luna, but again, everybody, this is an exciting time for our families to get 5 to 11-year-olds vaccinated. This is a game changer for our district, and it's a game changer for our nation.
Thank you, CEO Martinez. And good afternoon. Buenas tardes a todos. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago, y hoy les tengo unas actualizaciones. El Departamento de Salud Pública de Chicago y Chicago Public Schools, o nuestro Departamento de Instrucción Pública aquí de Chicago, anunciaron hoy planes para implementar la vacuna del COVID-19 entre los jóvenes de 5 a 11 años. Esto es un gran motivo de celebración. A la espera de la autorización de la FDA, que se están reuniendo hoy para tomar esa decisión, y luego el Centro de Control y Prevención de Enfermedades, tendremos, ojalá, ¿verdad?, poniendo todo por delante, a Dios por delante, tendremos las vacunas para cubrir niños de 5 a 11 años y protegerlos contra el COVID-19. Hemos trabajado en estrecha colaboración con el Departamento de Instrucción Pública, o el CPS. Así que con nuestra red de proveedores de toda la ciudad para asegurarnos de tener las vacunas en los consultorios de pediatras, médicos de familias, hospitales, farmacias y clínicas determinadas y eventos para empezar a vacunar a los niños tan pronto recibamos la luz verde, con el favor de Dios, todos vamos a recibir, la gran población que se presenta a las escuelas va a recibir su vacuna. Si bien la planificación aún está en curso, existen varias formas en que las familias pueden vacunar a sus niños contra el COVID-19. Entre ellas están, y citamos, su proveedor de atención médica, y le instamos, por favor, vayan a su médico primario, vayan a su pediatra, a las personas que le cuidan a sus niños en el diario vivir, porque ahí es donde pueden hacer todas sus preguntas. También el Departamento de Salud Pública recomienda comunicarse también con sus médicos. También si necesitan citas, tendremos citas disponibles. Si necesitan o no tienen médicos, ¿verdad?, que les sigan la salud primaria a sus niños, el Departamento de Salud Pública se hace disponible con información que le voy a compartir a continuación. El CPS también estará dando la oportunidad de vacunación en las escuelas, en sus clínicas. Por favor, visite al cps.gov edu/COVID para más detalle. Esto incluirá 4 clínicas regionales de vacunación en las escuelas secundarias, unidades móviles de vacunación, 15 centros de salud escolares que actualmente ofrecen la vacuna Pfizer, y todo en coordinación con los líderes regionales de las zonas de equidad de salud. Su farmacia local también será un punto importante, haciendo disponible la vacuna para niños de 5 a 11 años. Y estamos hablando de Walgreens, Walmart, Marianos, CVS y Jewel Osco ofrecerán vacunas pediátricas. Algunos hospitales para niños organizarán eventos de vacunación pediátricas. Consulten el sitio web de la ciudad chicago.gov/covidvax para obtener toda esa información y poder apersonarse de vacunar a nuestros niños. Algunos otros eventos comunitarios y clínicas organizadas por el Departamento de Salud también está disponible en esta página web, o puede también llamar al 312-746-4835 y se le proveerá con esa información. Todo es para un movimiento de la equidad y para disminuir barreras a que nuestros niños y nuestras familias, porque recuerden que la vacunación en la familia es el arma más poderosa para combatir esta pandemia, no tengamos barreras y la accesibilidad sea para todos. A partir del 15 de noviembre, todos los eventos comunitarios patrocinados por el Departamento de Salud Pública, así como las citas de Protect a Chicago a domicilio, comenzarán la vacunación pediátrica. Haga una cita en chicago.gov/@home. Otra vez puede llamar al número de teléfono y por favor tomen notas al 312-746-4835 y una persona en el idioma que tú entiendes y la cultura que es concordante con la nuestra recibirá la información y le hará esa cita médica. Todos los niños de 5 a 11 años, así como cualquier persona de 12 años en adelante que reciba su vacunación en serie primaria, serán elegibles para incentivos de $100 cuando reciban la vacuna en un evento organizado por el Departamento de Instrucción Pública o por el Departamento de Instrucción o CPS. Tenga en cuenta que las dosis de refuerzo, aunque están disponibles en eventos y vacunas al hogar, no son elegibles para incentivo. Acuérdense, los incentivos es para vacunar a todos los que no estén vacunados, que no hayan recibido ninguna dosis o que estén en el proceso de completar sus dosis de vacunación. Es donde el riesgo de contraer COVID y las presentaciones severas del COVID o hasta la muerte son más altas. En la mayoría de los lugares de vacunación, los padres deben acompañar al niño. Las excepciones incluyen clínicas de vacunación ubicadas en las escuelas del Departamento de Instrucción Pública o CPS, centros de salud de la escuela y algunos proveedores de atención médica con formularios de consentimiento firmados por padre o tutor. Los ensayos clínicos con miles de voluntarios han demostrado que la vacuna Pfizer es segura y eficaz para nuestros niños de 5 años en adelante. Al igual que con todas las vacunas del COVID-19, la FDA, el CDC y el Grupo de Asesoría en prácticas de inmunización de la vacunación revisaron cada fase de los ensayos clínicos y determinaron que esta vacuna es segura para el uso del público. Si bien se usa la misma fórmula que la vacuna de Pfizer para adultos, se espera que la dosis recomendada para niños, que ya sabemos va a ser 1/3 de la de adultos y jóvenes de 12 años en adelante, para niños de 5 a 11 sea 1/3, como ya les he mencionado. Todas las vacunas de COVID-19 son gratuitas, independientemente de su estado migratorio. No se requiere seguro ni identificación gubernamental. Obtenga más información sobre la vacuna del COVID-19 y encuentre vacunas para usted, para su familia, para sus niños en chicago.gov/covidvax. Gracias.
All right, thank you, Dr. Luna. I'll just underscore one thing that she said. I expect a lot of people have questions about boosters, will have questions if we have an approved vaccine for 5 to 11-year-olds. This week marks 1 year since our wonderful community COVID response team started doing contact tracing. They continue to answer the phone 7 days a week, 312-746-4835. If you need help finding a vaccine, finding a booster, you've got questions, that should continue to really be your first call, and we will help solve whatever is needed, including figuring out at-home vaccination if that's your best option. And with that, we're happy to take questions.
Dr. Arwady, could you just...
Here.
Oh, do we have... Do you really need it?
I'll give it to Stephanie. Yeah, because the people in the stream can hear you then.
Oh, thank you, Stephanie.
Yeah.
Dr. Arwady, can you just drill down a little bit and be more specific about... It's COVID. I don't really want to touch it. Be more specific about where we are in the transport. You said that
sure.
possibly as soon as
Sure.
Wednesday we're actually going to have it?
Yeah, so let me be specific about this. So we know that there is a lot of interest here in Chicago and across the country on the exact date of when 5 to 11-year-olds are going to be able to get vaccinated. I don't have that answer yet because I don't know exactly what's going to happen and the timing with the FDA and the ACIP. But there's been a decision, which we fully agree with at the federal level, that when the FDA gives if and when the FDA gives an authorization for 5 to 11-year-olds, which could happen as soon as in the next few days, we would then start the shipping process basically to Chicago and around the country. And that's where I was just sharing with you. We've already done all the work around where and how and dividing it up and the training. And, we've done a lot of work already to be ready. But no vaccine can be administered until after the CDC and the ACIP give its recommendations. We anticipate if the FDA would, the CDC would. And so I don't know the exact timing. You heard me say that we've got some of the clinics planning for possibly as soon as next weekend, but it will all depend just on the timing. But what I want people to know is when that approval is done, we will be ready, and there is vaccine already extensive plans about shipping and websites and all of the details from when the FDA gives that approval, but no vaccine can be given until after the ACIP, and I would really say the day after the ACIP kind of and CDC.
There's nothing.
There's nothing different about it. We're just putting some more details around that timing. So there's, I would still anticipate that it will be the first week of November when children in Chicago, 5 to 11-year-olds, likely are able to get their first dose of vaccine. But that really depends on the timing of the FDA and the CDC.
Dr. Arwady, is it just going to be Pfizer at this point, or what's the...
Yes. So for 5 to 11-year-olds, just like for 12 to 17-year-olds, the Pfizer vaccine is the only one that obviously has been authorized for the 12 to 17-year-olds and is being considered for the 5 to 11-year-olds. Moderna actually has submitted data for the 12 to 17-year-olds, and I expect at some point we will see the FDA probably also take that one up. But for 5 to 11-year-olds and really for everybody under 18, our focus will be on children. The difference is that the 5 to 11-year-olds, it's a third of a dose, and so it actually is a different shipping and a different process. But otherwise, it's the same ingredients.
You mentioned the term Hunger Games.
I did.
Bring it up. Are you anticipating? Is something to lead you to believe that it will be something like that?
No, but boy, have I had a lot of people, ask me whether we were going to, quote, see the Hunger Games again. It became a term that people used right at the beginning of COVID when, we were pushing vaccines out just as quickly as they were being manufactured. But there was, you all remember, there was a lot of demand without a lot of vaccine available. The good news is that the pediatric vaccines, there's been a long time to produce them while waiting on, obviously, the full studies to be finished and the review to be done. And so we are not in the same situation like we were at the beginning of this vaccine, highlighted by the fact that we expect to get, even in the very first week right here in Chicago, enough to vaccinate almost half of the 5 to 11-year-olds. So I would love nothing more than to see all of those vaccines go into arms. But the point is, we'll have enough. Check with your pediatrician, check with your pharmacy, check with your grocery store that has a pharmacy, check with the hospitals, and then look for community clinics, and we'll be standing those up really over November and December.
quick question here. When it comes to kids, I know some of the parents, they still think it's too soon to give them the vaccine. They are still afraid. They might want to wait. Is there any repercussion? Is there any plan for those families that refuse to do the vaccine this year or soon?
Yeah, so the vaccine remains not required for children, right? It is recommended. One of the reasons I was sharing, for example, the fact that in those 12 to 14-year-olds, just over the last couple of months, they've been 10 times as likely here in Chicago to get diagnosed with COVID if they're unvaccinated, is that really the repercussion is running that risk of COVID. And that for the children, we worry that they also have the potential, of course, if an unvaccinated child, when we see an unvaccinated child, it is more likely there are others in their network who may be unvaccinated, adults, et cetera. And there is a lot of potential for unnecessary, disease, hospitalization, and death. We certainly will continue to have vaccines available. I don't anticipate us having an end date that vaccine would be available for those younger children. We, of course, are also expecting probably sometime next year vaccine available for even children under 5, but we're not there yet. So really, my advice would be to do this as soon as possible. I've also heard a lot of, parents, you heard CEO Martinez talk about we're still needing to quarantine a lot of students. When students are fully vaccinated, they do not need to quarantine, assuming they don't have symptoms, et cetera, et cetera. And so if you don't want to be trying to do home learning for your child, you don't want to have that disruption, et cetera, for children, for adults, getting vaccinated also helps have less disruption of learning too. So that's sort of another recommendation, right? So these are the things. There's not anything punitive around it, but we do worry that where we have schools or any other place where lots of children are gathering who are unvaccinated, those would be the settings, of course, that we would be more likely to see potential spread. Every person who gets vaccinated, they're protecting themselves, but they are also protecting the other people they come into contact with. And I think that's especially true in schools.
A question that just arose. I know that some adults are also afraid, and you mentioned that the vaccine for kids is going to be the exact same formula as the Pfizer for adults, except the dose will be less. Would that be a good option for those adults that are afraid? Can they request maybe the children's vaccines until they get comfortable?
Yeah, it's a good question. The answer is no. Most likely, the CDC will weigh in officially, but the reason that lower dose is the one being studied is that in the studies that were done for children, one of the reasons that it takes the time to sort of do these studies is they actually were comparing for children who volunteered to be in the study, their parents volunteered them and guardians to be in the study. They were checking the blood levels for the antibodies, meaning the level of protection that children had against COVID. And what they were working on was how do we make sure the antibody, the protection level, is as high as it is in adults with as low a dose as possible from a side effect standpoint. So adults and older teenagers do need that level of vaccine that is appropriate for teenagers and adults. It's really because those younger children have less body mass and are smaller that lower dose is recommended. But if there are people concerned about side effects still, I'll tell you the number one side effect we continue to see is actually no side effect, followed by the sore arm. When I've gotten mine each time, I've had a little bit of a sore arm. I've been lucky I haven't had anything else. We do continue, we see some people have short-term side effects for sure. Those last typically 24 hours, sometimes 48 hours, and people can feel, some people can feel not that well for a day or two. But compared to what we see in people who get COVID-19, where we see people, even people who are apparently young and healthy, sometimes get so seriously ill, and where I've seen people get this long COVID that we're still learning about, I very, very strongly recommend people. We've had more than half of the world's population now has gotten a COVID vaccine, by the way. So this is no longer in any way sort of an experimental vaccine. We've got we've got a year and a half almost now of safety data from those earliest studies. Vaccines do not work. I also have been getting a lot of questions about I want to wait 3 years, I want to wait 5 years, I'm worried about long term. I just want to be clear with folks, that's actually not how vaccines work. We've never had a vaccine that has been authorized that has shown up to have side effects years after the fact. Where we worry about it, and in those first studies, it's really in the first 6 to 8 weeks. After that, this is not something that has long-term effects. The vaccine does not hang around in your body, right? The whole thing with mRNA vaccine is it actually is gone within just a few hours to a couple of days. And so this idea that something is going to turn up later, we have no reason to think that would be true. We have no evidence that has ever happened with a vaccine. But we do have evidence that in the middle of this pandemic, we continue to see so many people dying still every day, right here in Chicago, across the country, around the world. And so, I would not be so strong on the safety and efficacy of this vaccine if I'd not spent a year and a half looking at really almost every study that's coming out. And I remain very, very pleased with how this vaccine is performing. And I remain extremely reassured by its safety.
A couple questions about the clinics. You talked about what CPS is doing. Just before you start, I also had a question about whether CDPH is putting clinics at park districts. Yesterday we heard state officials reaching out to schools and park districts. Just wondering if that's a possibility in Chicago.
Sure. So really at the moment, we will continue to have we continue to have a wide range of community-based clinics. We've been at a lot of the aldermanic offices. We have been at some park districts, et cetera. At those clinics where we're offering flu vaccines, we're trying to tie that in with COVID vaccines. Where we're thinking really about the push for children, we are, like I said, doing some of these larger weekend-based events, especially around city colleges, which we know a lot of Chicagoans already use to get vaccinated the first time around. And then we're focusing on schools, really, first and foremost, because we know, as you heard, this is where the kids are coming. This is where parents and guardians, automatically are getting information and can have that information. So we don't have any, major plan for parks at this point, especially when in the winter in Chicago, it's not as much yield for us. We will, of course, see how things roll out here, and as we have done all along, continue to really get rid of barriers for anybody who has trouble accessing vaccines. So, we continue to be the only large city in the United States that is offering that at-home vaccination program. No questions asked for anybody over the age of 12, right? We will be expanding that, just not right away at the beginning to the 5 to 11-year-olds, just while we get through the first big batch. Then we'll move some of our resources that we use in these larger clinics to continue to support that at home, for example. So, we will continue to adjust, but my team has been making plans literally for months, and I'm extremely confident that our health system, the best place still, your home pediatric or family practice, who knows your family, can get the rest in. But we are in an excellent place in terms of vaccine eligibility. And please, please take the opportunity to get older kids, yourselves, your grandparents, get everybody done as we're thinking about the 5 to 11-year-olds. We just want to put COVID behind us and be done with this. And vaccine is clearly the best way to do that.
And then I could just clarify, you had a couple questions about our CPS events. So
were any of the clinics new? That was really my question.
Nope. So it's our 4 regional sites that are spread out throughout the city that are currently serving our, families and those who are 12 and up, and we'll expand those to 5 to 11 once that vaccine becomes available. And then we have our mobile sites throughout the city that are visiting schools as kind of individual events with a 2-week follow-up. And then we also have our school-based health centers. And so cps.edu/COVID results has a list of our regional vaccine sites as well as the school-based health centers that are currently offering vaccine for 12 and up.
Thank you.
Great, thanks everybody.